Hello, my name is Lauren Kretschmer, and I will be doing my case analysis research presentation video today on the opioid epidemic. And so I will start by explaining and describing the certain case analysis the case study that I received to analyze. So Penelope is a 22-year-old woman who comes from a low-income community where the sale and distribution of illegal opioid drugs runs rampant and is very, very common in this community. So Penelope's story begins when she was out with friends and she did succumb to some peer pressure and tried snorting heroin for the first time. So, nothing awful happened to her. She didn't overdose. She didn't really receive those negative adverse effects. So the next time when she was offered the drug, she was a little more compliant in trying it again. Unfortunately, the next time she snorted heroin, she passed out unconscious and, paramedics were called and she was able to be resuscitated by the paramedic. When she did regain consciousness, she was in the critical care unit of a hospital connected to a ventilator. Her snorting of the heroin did cause a spontaneous bilateral tension pneumothorax, and she had 2 chest tubes in place for pleurovac drainage, and those were in place for a total of 4 days. So when the tubes were removed safely, she was placed in a facility for treatment and rehabilitation, which is where she currently is, continuing to get that treatment and the help that she needs. So with this case study, I wanted to focus on, the influencing effects that your community has on drug addiction and that peer pressure that comes from many, many different aspects of the place where you live. So beginning, I will start with the prevention methods that are implemented in both youth and adult populations. And so starting with youth population, the kind of interventions that are placed here are called youth risk and protective-based interventions. And so essentially what that means is they're using a combination of scare tactics, which could be statistics, stories, personal experience, but also showing success stories, showing the opportunities they could have when they refuse and say no to those drugs. And this method of youth risk and protective based intervention has shown to be very effective in that 8th to 12th grade age range. And this is because this is the certain age where influence is very important, where you can either be negatively influenced by your peers or positively influenced by your peers. It's when your mind is changing, you're adapting, and you're kind of finding where you belong into that social food chain. Continuing into that adult prevention method, it's a little bit more scattered with what is and isn't effective because not enough research has been conducted. And this is because prevention is really difficult in adult populations because typically this person has already struggled with addiction or is currently struggling with an addiction. So it's hard to implement an intervention to prevent addiction when it's already occurring. Another thing is a lot of times adults have multiple addictions. So they could have an opioid addiction and they could have an addiction to marijuana. And that hand-in-hand thing, it just creates a larger frame to work on with the interventions. Another thing that is a cause of this opioid use are psychiatric issues. And so with the psychiatric issue, it also then feeds into the dependency of the person's need for these opioid drugs. So all in all, there actually has not been an effective method found for adult intervention prevention methods, and it is something that needs to be further researched to find a more concrete, proven way of presenting a helpful way for this to be ceased and help with cessation of addiction. The next aspect is the drug regulation within a medical facility. So this is like a hospital, a primary care center, anything where you would be prescribed by somebody some kind of opioid drug. So the biggest problem in prescribing is in the management of chronic pain. So this is cancers, arthritis is an example, those long-term illnesses that are lasting more than 6 months. So essentially the guidelines that are in place for these certain prescriptions do not coincide with the research that has been tested to show the effectiveness of that said drug in the pain management. So it's a very confusing thing, and it's why there are issues now, is that the regulation of the drug and its effectiveness is not coinciding. There's really no connection between the two. So essentially you could say that, physicians are kind of shooting at the hip. So what happens with, the misprescription, or like the false prescription of like the wrong dosage or quantity, does lead then to misuse or sale of these drugs in certain communities or to certain people. And like I said, dosages and the amount is a big problem, because if you have excess pills, then that just leads you to the opportunity for misuse and to misuse that drug. And then the final aspect that I wanted to look at was more big picture stuff and how it's influencing, politically and economically, the opioid epidemic, how it has influence on those. And so it was shown in research that in voting files taken from a certain state, that those who suffered from an opioid-related death in the family were less likely to vote in primary elections and elections leading up to the primary election. So there was little participation from these individuals in elections in their state. And this causes a lot of issues because, you're not getting equal participation. You're leaving out a big demographic of voters who are not contributing to their part in society. The more shocking part that I found in my research was the economic toll that the opioid epidemic has taken. So in 2018, actually, the total cost of all realms of the opioid epidemic was $631 billion. So this affected the United States infrastructure in so many different ways. This goes to government agencies such as healthcare facilities, police stations, officers, all that stuff. They're pulling money because they can't maintain and control what is happening with these drug distributions, overdoses. It's pulling more money than it's obviously bringing in because it is an illegal activity. And so looking at that, some next steps and recommendations, beginning with the prevention and intervention methods, is finding a more concrete way of finding a prevention intervention method for those adult populations whom have or are currently struggling with addiction. It's very important to limit and restrict addiction in all realms and ages and demographics. Secondly is doing further research to identify a congruence in the regulation and the prescription of opioid drugs for pain management, because with the method they have now, there is misuse occurring excessively because there is not the right prescription being prescribed to a patient. And finally, helping rehabilitate these families and these individuals that have been impacted by overdose-related deaths is very important, because we need their participation politically and economically to be able to maintain this, infrastructure in the United States. So in conclusion, there is research being done to, analyze and look at all of these elements. It's just really narrowing down on those solutions to find an effective way of trying to boot this opioid epidemic. Thank you very much.